we are situated at Lady Pohamba Demoshuya Suites right here in Kleinokupa, OB-GYN, where we bring to you OB-GYN Chats. And this time we are joined by Dr. David Emvula. Dr. David, welcome.
Thank you for having me.
Thanks for always joining us. We know you're a very busy man, but you make time.
Yes, indeed. Thank you.
Great. So throughout the course of the months, we've been tackling different issues and topics. This one is different.
Yes.
Asherman syndrome or Asherman. I've never heard that terminology before.
Yes, indeed. It's one of those rare conditions in gynecology, but it's becoming more and more common. Perhaps probably we are improving our diagnostic capabilities.
Yeah. Yes. So what is it, doc?
So when you speak about an Asherman syndrome, it's actually named after an Israeli gynecologist who did a lot of work in this subject, and it refers to scarring tissue inside the uterus. As we always try to explain, the uterus being like a balloon cavity, so then one can imagine that the two opening layers of the balloon are now scarring to a point where they are attached to each other, and then they won't be able to expand, for example, in pregnancy. So there is scarring there that is attaching. So it's the scarring tissue within the uterine cavity.
Okay, great. So with this diagnosis and, giving background what it is, what are some of the symptoms? Like, how would you know you have it?
So the most common symptoms is related to menstruation changes. So as I highlighted earlier, that it has to do with the scarring of the area inside the uterus where a woman would normally bleed monthly. So if there isn't any scarring in that area, one of the common symptoms that women will have is changes in their menstruation cycle. And if it is what we call severe, or in worst case scenario, they may actually go without seeing their periods at all. A condition which we refer at amenorrhea, where they go months and months and up to years without seeing their periods. We know that you only stop having periods around about the age after 40, most women around the age of 50 when you reach menopause. So you can then imagine that this is a young patient who then doesn't see their periods, which is abnormal.
So let's say one of the signs, not having your period, and you are younger than that age bracket, what other reasons should advise you to go to your GP or your specialist to make sure that it's not that? What other symptoms?
So the most common ones are those ones. However, then if it is also infertility, if you have been trying to conceive, and then it's also one of the common possibilities that one needs to evaluate, because if there is scarring within the uterine cavity, a baby will not be able to grow there. So it can also be one of the reasons why you might go and seek help from your doctor. And one of the causes could be Asherman syndrome.
So when they are diagnosed with that, what's the way forward, doc? What's the treatment process? Can you get rid of it? Is it terminal? Is it something you can get rid of?
So once then you are diagnosed, obviously scarring tissue is scarring tissue, because and what really it means is that how you get this scarring tissue, it means the layer that normally breaks out every month from the uterus is known as the functional layer. If the one that causes the regeneration of the functional layer is destroyed, you can't replace it. It is usually a permanent condition, and in terms of management, it also then depends on the severity. If we classify it into at least 3 groups, we call it mild, which is less severe. And those ones, if you cut out those adhesions, those women might still be able to have normal regular periods, and if it was infertility, be able even to conceive. But from moderate to severe, it means that the scarring of the inside of the uterus is so extensive to a point that even if you cut it out, it is pointless, because the damaged layer of the inside uterus that was supposed to bring about the functional layer that I'm talking about is not possible to be replaced. And in most cases in those patients, there's little that we can really do in terms of restoring their menstruation cycles, or also to be able to conceive, because we know that the main job of the menstruation cycle is to conceive. So if they had fertility wishes, it might be a problem.
All right. What are the long-term impacts, especially for a female, lifestyle, reproductive, even long-term?
So in terms of long-term, it depending again on the severity, but those patients that have a mild might be able to conceive and also be able to have normal regular periods until they reach the age of menopause. But for those patients that have very severe, it does have a significant impact in reproductive, because they may not be able to carry the pregnancy and even conceive. And in this aspect, these are the patients that may need assisted reproductive technology and even surrogacy, because of the uterus that is not able to carry the pregnancy. So in that circumstances, they will be cancelled for surrogacy, and it might be the only option for them to be able to conceive.
Wow. Any preventative measures, or once you have it, you have it?
Yeah, so preventative measures are very much limited, because if you are to look into what really causes this condition, it can be related to infections. And one of the serious infections that we found is actually infection like TB, which are not really sexually transmitted. You can't really do much about that. TB is everywhere. Other infection can be bilharzia, so we maybe must just stay away from unsafe water, especially in the villages where there is bilharzia. And then the other causes is actually from us as clinicians, because for example, when we clean the womb in a woman who had, for example, a miscarriage, we most often do cleaning of the womb. If we clean too hard to a point where we damage the layer that is supposed to cause regeneration of the functional layer of the endometrium or the uterus, it can cause Asherman syndrome. Even cesarean sections. Sometimes how the techniques that we do a simple cesarean section, it is also, so some of these are actually complications of what us healthcare workers do. So it is also important that as clinicians we are aware of this, so that, of course, like I said, cesarean sections, if we operate someone for fibroids, myomectomies, and all these procedures can all be related to later on as a complication. So in other words, I think you need to seek help from an experienced clinician to make sure that later on you don't end up with complications, despite other causes that we spoke about, such as the infection, which there is very much limited that we can do.
Great.
In terms of prevention.
Doc, you've shed more light on a very interesting topic for today. Thank you always for lending your time and your expertise.
Yeah, most welcome anytime. We really like to educate our people, and we know that it's always good to make sure that when a woman, or any patient for that matter, go and seek help, it is important to read up and have an idea, so that it helps you to understand the condition. And it's also part of healing when you know more about the condition.
True. If you know more, you can prevent.
Yes.
Thank you so much, Doc.
Most indeed.
There you have it from the experts themselves. That's Dr. David Emvula. Please feel free to subscribe, comment, give your opinions, even give your feedback on the comment section. We really appreciate to hear your voices, and we will be back next month with another edition.